if using antidepressants like the SSRIs actually worked, like we see with all those happy people in the drug ads, right? Well, then I would use them, right? I wouldn't tell people to change their diet and exercise and change their lifestyle, but they don't work. And we don't hear the truth. You know, in the New England Journal of Medicine, a study was published that showed that studies on antidepressants that showed a negative outcome were underreported. In other words, drug companies only publish the studies that show things work and don't publish the studies that show they don't work.
I wanted to let you know about the latest bad news for a major class of antidepressants, the SSRIs, which Prozac is the prime example. A new study shows that they appear to significantly increase the risk for stroke. We can now add this to a seemingly endless list of side effects, including sexual dysfunction, weight gain, doubling the risk of suicidal thinking, increased diabetes, reduced bone density, an increase in violent behavior, increases in breast cancer, and on and on. For mild and moderate depression, the antidepressants work about the same as placebo. Placebo works pretty well. You tell someone that you're giving them something to make them feel better, and it does help, even if it's just a sugar pill. And remember that each of these drugs was developed with profit as the primary goal, not health. If health were the primary goal, they would test the drug against a natural treatment. And then we would use the winner, which would be the most effective, least toxic, and most cost-effective treatment.
So it can really be doubted whether antidepressant drugs have any effect at all. But what they do is that they make people dependent so that they go on for years. And I have seen data from Finland that people who were put on an antidepressant drugs, even 5 years later, almost half of them were still taking an antidepressant drug, and they also took an antidepressant drug in the intermediate years. So they took it year after year, half of them. And in the old days, psychiatrists said that depression is a self-limiting disease. Even without treatment, most people get better. So quite few cases become chronic. Now the psychiatrists say that depression has changed. It's another disease because now it's more chronic. And what they don't realize is they created this with their drugs. This is insane.
Absolutely. These drugs can cause suicidal thoughts. For example, the drug companies knew this early on. They knew the agitation that is common with these drugs. They knew that before they were ever approved the first time. We know, for example, that those on Prozac, after only 5 to 6 weeks, 10% report having shakiness like this.
Okay.
Zoloft the same kind of way, 11% after 8 weeks like this. And so we know that it's causing a real problem. The concern is what happens after a year or 2 years or 5 years on these drugs. What is happening to the brain? We do know that it causes you to have that natural instinct to preserve your life blunted. And so I think people who have friends on antidepressants or antipsychotics, they've seen this. They've seen their friends with those blunted emotions. They're walking around not quite them.
Okay.
Their emotions are blunted. Sometimes I've had people tell me they felt like they wanted to cry, and yet they weren't able to cry. And so the emotions are blunted.
In addition to driving the person with this amphetamine-like effect, the antidepressants kind of do a bit of a lobotomy. You lose your empathy. You lose your caring. These drugs are causing agitation, anxiety, insomnia, hostility, aggression, mania.
And not only that, but look at all the things that the antidepressants cause. They cause kidney failure, which leads to people being on dialysis forever. Serious weight gain. People get on antidepressants and they gain 30 to 40 pounds usually within the first 3 months. Obesity, okay? Look at that epidemic. Diabetes. So not only are these damaging, but they're also causing more and more other problems that people need to be medicated with. And the thing is, there's no test, documentation, no blood test or anything, x-rays, that can actually prove that anyone has a mental imbalance.